Good evening and welcome, everybody. I'm just going to give another minute or two. We have more people coming in from the waiting room. So welcome everyone to our October Meet the Experts. I can't believe it's October already. I'm sitting in my basement with a heater beside me because it's cold in my basement. It's been cool this week, but thank you for sharing your evening with us. We have a fabulous presentation and workshop planned for you. So tonight on our agenda, we have a wonderful speaker joining us named Rebecca, who is going to share her insights on perinatal mood and anxiety disorders. We also have two team members from Helping Hands that will share. Christy will be discussing pregnancy, and we also have Jessica doing our postpartum. So we have a really great presentation for you, and it's fitting because October is Mental Health Awareness Month. I think every month should be Mental Health Awareness Month because we all need to focus on our mental health. So after Rebecca presents, we will have a quick Q&A, and then at the very end, we will have a Q&A as well. So we know that we don't always remember our questions. So when you have a question, just shoot it in the chat, and we will go over the questions during the question period. You can also unmute yourself and ask a question during that time. And then we have the really fun part of our meeting where our doulas will do kind of speed dating. We set up some breakout rooms and have you meet the team. And it's really great to get to know our doulas. So we'd also like to get to know you a little bit. So in the chat, if you could put your name and are you expecting or have a little one already? And you know, are you a client or looking for information? So just a little bit about yourself. So to start us off today, we have Rebecca from the Well Parents Center. And a little bit about Rebecca. She specializes in pediatric mental health with experience in both hospital and community settings, and believes becoming a parent has inspired Rebecca's interest in maternal mental health, which is definitely, when you experience something yourself, brings an awareness. And Rebecca offers parenting consultations as well. So Rebecca, take it away. You should be able to share your screen now.
There we go.
All right.
Thank you so much. Hi, everyone. So as Christy mentioned, my name is Rebecca, and I'm a social worker at the Well Parents Center. My role there, as Christy mentioned a little bit about, is to offer individual therapy and also parenting consultation. So that's for folks with children who are babies all the way up to teenagers. Today, though, I'm here to talk to you about perinatal mood and anxiety disorders. I'm hoping that you can learn a little bit about what they are, and most importantly, how you can go about getting help if you think you need to. Before I get started, I'll mention that a lot of the research in this area is done on mothers and women and fathers, men. So I'm going to be using those terms where appropriate throughout the presentation, and acknowledge that that terminology doesn't fit for everyone. So I will try to use more inclusive language where it's appropriate. So what I'll go over today is a general overview of what these perinatal mood and anxiety disorders are. It's a mouthful, so I'll say PMAD sometimes. What to look for, the risks and compounding factors to developing one of these challenges, and of course, how to get help. Okay, so these PMADs, as I said, are mood and anxiety disorders that occur during the perinatal period. So what we define that as is starting at the moment of conception and running all the way the first year postpartum. And that includes folks who have experienced a loss as well. Now, unfortunately, there's not a lot of research on BIPOC women, LGBTQ plus parents, non-gestational parents like surrogate parents, for example, and their perinatal mental health experience. There's some, but it still has a way to go. What we do know, though, is that these populations tend to be at a higher risk of developing these mental health challenges. There are a lot of reasons for that. Some of the main ones are maybe lack of equal access to healthcare or discrimination within the healthcare system. Now, this is obviously a problem, and overall, we know that screening for these mental health challenges is not universal. So something like screening for gestational diabetes is something that typically occurs to all people who are pregnant. Screening for mental health is not. So that leads to problems because we can't always see when someone is struggling with their mental health, and an untreated mental health issue can lead to longer term problems. So consider an example of a mom with depression, for example. Let's say she's at home, she's experiencing low mood, she's starting to become forgetful, she's not making it to her doctor's appointments, she's got this baby that she's sort of having a difficult time connecting with, not bringing the baby to see his or her doctor. You can see how these things start to snowball. And if there are any issues with the mother's health, with the baby's health, and they're not being checked upon, this can lead to bigger problems down the road. So it's really important that folks are screened if they need to be. Now, what are these disorders? So clinically speaking, they include postpartum depression, postpartum anxiety, postpartum OCD, PTSD, and postpartum psychosis, and also perinatal bipolar disorder. So you'll notice that I've bolded the first two, depression and anxiety, and I've included prevalence rates, and these are for women. So 20% of women will develop postpartum depression, and 8 to 20% will develop postpartum anxiety. These are the most common, which is why I'm highlighting them, because it's more likely that folks will notice some of these types of symptoms. So I'll go into a bit more detail about that for you. So you'll see I have postpartum depression and anxiety here. I've also included the baby blues because this is a term we hear a lot about. And I want to be clear in sharing that the baby blues is not a mental health disorder. So this is not a clinical mental illness. The baby blues is sort of a shift in emotion that occurs to 60 to 80% of women after having a baby, or individuals after having a baby. And it's related to those changes in hormones, the acute sleep deprivation that happens. So it's quite common. It can be characterized by tearfulness, moods shifting all over the place, feeling exhausted, feeling reactive to everything around them. Typically, it will start within a few days postpartum. It peaks between days 3 and 5. And then by 2 weeks, these symptoms start to come down and people start to feel a little bit more stable. And that timing piece matters when we're looking at, diagnosing a mental health disorder. Now, postpartum depression is not diagnosed before the 2-week mark. So anytime 2 weeks postpartum into the first year, postpartum depression can be diagnosed. Most folks will feel quite sad, a lot of guilt and shame, irritability, maybe overwhelmed. Some folks might have a hard time connecting with their baby and maybe even experience suicidal ideation. Now, as I said, it's not typically diagnosed until 2 weeks postpartum, but this can also occur anytime within that first year. So I've worked with some clients who are a bit surprised because the initial few months were okay for them mood-wise, and then they developed depression maybe when their baby was 6 or 7 months old. So this is possible, and it could still be postpartum depression that person is struggling with. Now, anxiety on the other hand, people will experience panic, intense physical sensations, They'll have excessive worry, often racing thoughts will occur. And again, this illness can be diagnosed within the first year as well. Now, this is a lot of information and it's pretty technical. The main thing I like to tell people is if you're struggling with your mood, you don't need to worry about looking at this chart or kind of worrying about, do my symptoms fit anywhere? The main takeaway is if you're struggling in any way, then it's important to reach out and let someone know about it. So I wanted to include a slide here about fathers because there has been research done on these perinatal mood and anxiety disorders in fathers. And I will say a lot of this research is done on heterosexual males and couples. So postpartum depression actually affects 10% of men between the first trimester and through the first year postpartum. And what we know is that if a man's spouse is struggling with a mental health issue, then he is at a much higher risk of developing a perinatal mood and anxiety disorder as well. Generally speaking, these disorders can look or present differently in men. So often it might be expressed as being quite angry or aggressive, maybe substance use as a way to cope. So I wanted to sort of take a moment to acknowledge that often we have expectations or assumptions about, how to getting pregnant, about pregnancy itself, labor and delivery, and then of course, parenthood. And so I wanted to share some of the things that I've heard or been told over the years. You'll get pregnant when you stop trying. Pregnancy leads to a healthy, live baby. A good birth is a natural, non-medicated one. When your baby is born, it will be love at first sight. And the non-birthing parent doesn't really understand what's best for their baby. Now, I'm sure many of you listening can already start to think of some of the things they might have been told. Feel free to type it in if you want to share in the chat section. But we're all exposed to these, and told what we're going to feel and how it's going to go. And it can be really challenging to not have expectations about this process. So how are these relevant? Why am I bringing this up when we're talking about mental health? The reason being is they relate to risk factors. So what we know from the evidence is there are some things that are directly linked to someone's likelihood of developing a perinatal mood and anxiety disorder. So if they've had one in the past, if they have a history of mood and anxiety disorders in the family, if someone has had a significant reaction to hormonal changes in the past, maybe certain health issues, fertility issues, if you don't have much support within your family or your partner, folks that already have kids, folks that are struggling with financial issues, and then those who have survived childhood sexual abuse are also at a higher risk. Now, in addition to these risk factors, there's what I called compounding factors. So those are the things that, might just tip someone over the edge, so to speak, of really struggling. So if there's a reason for an abrupt end to breast or chest feeding, the lack of sleep, relationship stress, loss, complications during your pregnancy or birth, a difficult temperament in the baby, if the parent or the child has health problems. And then for those of us parents that tend to be a bit more perfectionistic and needing control and needing to know how things are going to go, these are things that can make it a little bit more likely that we might struggle postpartum. So in saying all of this, one thing that you can do at home and now even start thinking about it, I invite you to reflect on whether or not you have any assumptions, whether you have any expectations. And sometimes we don't even realize we have them until we start thinking about it. Try and pinpoint if there are parts of your journey, parts of your process that are really important to you. So for instance, if you're someone who really, really wants to breastfeed, and you know that that's a very important value of yours, and that there's a chance that for some reason it may not work, it's important to note that, because should things not go the way you expect, that way you're sort of primed to be aware that this could be an issue for me, and you'll be more likely to reach out for help if you do have an issue. So of course, how to get help. My number one thing that I like to tell people is to try and talk about mental health just more generally with your partner, with the people that are closest to you. Make it a normal conversation. And it's good just to check in with each other so that if there's any red flags, if there's anything that's not going well, you can get on top of it. Of course, reaching out to your midwife or your primary care person is also super important. And then therapy. So there are a few evidence-based therapies that have been shown to be very effective in treating these disorders. CBT is one, IPT, and group therapy are all evidence-based modalities that work quite well. In addition to that, something that folks can do a little more easily is to try to connect with others. So if you're not sure of your local parent groups, I would recommend you try to see if there are any, whether they be online or a drop-in. Try your best to build a community of people who are in a similar situation, who have, maybe babies that are at a similar stage or at a similar stage in pregnancy. It really helps to share tips and tricks, share things that are working and what aren't working, just to reduce the sense of isolation that can really set in when you're going through this stuff. So as we mentioned, the Well Parent Center where I work is a great resource. So we offer many different services for parents to be, for parents, and just for individuals, families. You can see more about our services on the website there. If you have specific questions or would like to book a service, you can feel free to reach out. The information is there on your screen, and myself and a few other clinicians are accepting new clients. So feel free to reach out if you would like. And I'm also happy to answer questions through email. If something comes up later on, you can reach out and reach me that way. And that's it for me.
Thank you, Rebecca. We didn't have any questions come through the chat, but was there anyone that had any burning questions that they would like to ask Rebecca? No? Okay, perfect. Well, her contact information will also be sent out with this recording, as well as in the description on YouTube when we put this up. So they'll be able to reach you in multiple ways. And thanks again for taking the time to chat with us today.
Oh, it's my pleasure. Thanks for having me.
Awesome. So we are now going to move into our doula chats. So we have Christy from our team. Yes, there are two Christys on the team, just to keep people confused. But Christy is a birth and postpartum doula on our team. And Christy is an enthusiastic traveler. She has lived in 4 countries and have had the pleasure of visiting 36 countries and territories. That's crazy. It's so awesome. Lots of amazing experiences, I'm sure. And Christy has completed midwifery training with the Indie Birth Midwifery School. And Christy is going to focus on the pregnancy and preparation for birth part of our whole mental health. So take it away, Christy.
Hello, nice to see you all. So the first slide we have up here is I just wanted to say that mental health is such an integral part of the parenthood experience, and you can have like a really wonderful birth, like for instance with my son, which is the child on the right here. He's 11 years old, and my firstborn. We had a really wonderful birth, and you can see how we met each other. That's him laying on my chest beside there. And then with my second child, who's Caitlin, she's 9 years old now and thriving. We had an entirely different experience. And so that's our first meeting, and it actually happened to be 6 hours after she was born. So it was entirely different. And they both ended up with good outcomes. But actually having a really wonderful birth did not prevent me from having postpartum depression with my son. And oddly enough, it didn't surface until about 8 months afterwards. So yeah, what I want to talk about, like what perhaps some of the things I wished that people had told me or wished that I had known before going into this journey. So yes, I'm going to try and keep it focused to pregnancy, but some of these things are applicable before, after, and during pregnancy. So some of the experiences that I have had were very traumatic. And indeed, I had, after my daughter's birth, I developed post-traumatic stress disorder. And that was not unsurprising given the nature of her birth, but traumatic things can happen like on an entire spectrum, and how it traumatizes you is not necessarily related to the degree of how much bad things happened in your birth. So how does it happen? So what I've learned, a lot of this, I'm not a mental health professional, but I've taken some psychology classes, but most of this I've learned through my own experiences and having to seek out and use resources that we've had in our communities. So the next slide, please. Thank you. So how does it happen? When you're in a very intense experience, which childbirth can be, your emotions can reach like sort of a boiling point, and there's like an overload point, an overload switch in your brain where the fight or flight or freeze sphere of your autonomic nervous system, it tells you when there's something dangerous and allows you to do something about it. But sometimes, like if you're giving birth in a hospital, like the instincts that you might have to avoid this threat, you can't do. So this overload switch tips it over, and it allows you to keep going through this really scary experience that your body's experiencing as terror, but can't actually fight or flight through it. So what it does is basically it just allows you to keep going, and then you save some of that to process later. So the mind sort of compartmentalizes some of these emotions, and you can process it later as you are away from the threat. So it may still be difficult to process later, though. That's the problem with some of these things, is that when you revisit it, you're again reaching that overload switch. So what you don't want to have to do that, right? So it may be difficult. So yeah, you can't process it in a timely fashion. And I want to point out, as Rebecca was good to point out, this can happen for either parent in the situation, the one who's giving birth, or the support partner who maybe has witnessed something that for them was really scary or traumatic. How does it look like later? Hypervigilance. And not being able to sleep. So hypervigilance means like you're kind of jumpy and you hear every little thing. You can wake up out of a dead sleep when the baby snorts. This can also be something normal that happens in the first few days after giving birth. Your brain is going through a process of just changing to adapting to being a parent. So hypervigilance can be normal, but it can also be pathological if it doesn't allow you to sleep. So if you can't sleep, either because you're hypervigilant or because you've got racing thoughts or recurrent nightmares. So another thing is recurrent unwelcome thoughts, like you keep thinking about this thing that happened and you don't want to think about it. You don't want to face it because it's too overwhelming to you. Feeling jumpy, like there's always adrenaline running through your system. Basically, when you're in that sort of frozen in the fight or flight sphere, your body is constantly producing adrenaline, and you can just never settle down. But the problem with this is it eventually leads to burnout, and it could lead to depression later on if you can't come out of that fight or flight phase. Your body needs to keep running on overdrive until you no longer have the bodily resources to handle. So what do you do about it? You can avoid it in the first place. So how does that happen? I think one of the number one best things that you can do during your pregnancy is to make a practice of learning self-calming techniques or activities that you can use in intense situations. So this could be breathing techniques, or it could be meditation techniques, mantras, grounding techniques where you consciously make yourself aware of your environment, like, okay, 3 things that I can see, and I'm focusing on those 3 things, 3 things that I can hear, and I'm enumerating those to myself, 3 things that I can feel, 3 things that I can smell, and maybe 3 things that I can taste. I don't know if you can taste more than 3 things at once if you're not eating, but going through those sensories and bringing yourself back into your body can help your body realize that the threat that it perceives is perhaps it's not going to necessarily kill you at that moment. So you can drop back into your body. Have a person with you, or plan to have a person with you in your birth who knows how to co-regulate their emotions and their bodily responses. So you'd be surprised at how incredibly resilient you can be through what is a very scary or intense situation if you have somebody there with you going, you're going to do this. You can do this. I believe in you. Remember to calm yourself. Remember to ground yourself. And if you can copy their pattern of breathing and you can make eye contact with them and bring yourself down into your body the way that they're bringing themselves down into their body, it can stop a traumatic response before it even happens. I love that Rebecca talked about expectations, because a lot of times when people have had traumatic experiences in their childbirth, it's like one of the number one things they say is because I felt like I didn't have control anymore. So how does this relate to expectations? If you understand your birth preferences and the birth choices and all of the things that may happen routinely in the hospital, there may not arise a situation where the doctor does something that they believe is a routine, but for you is feels like taking away your control. So there's a big difference between, in childbirth, you need to release a certain amount of control in order to allow your body to birth the baby. There's a big difference between you relinquishing your control to the process and somebody taking that perceived sense of control away from you. So if you understand and have like contingency plans and you discuss this with your care provider, you're already at a much better stance to be able to handle whatever comes your way. And also hire a care provider that you feel comfortable discussing your options and alternatives with. So if you have a care provider that says, yeah, we can talk about that later, or that's not going to happen, you don't even need to worry about that. I have 30 years of experience and that would never happen, hire a care provider that validates your concerns and really listens to you and understands how they can tailor your experience to be something that's deeply meaningful and even enjoyable for you. So, and then at that point, if you have that confidence in your care provider, then you're able to let them make the best decisions when something crazy does arise, and you know that they're not necessarily just they're aware of the potential triggers or anything that might happen for you, and they can keep your mental health and your wishes in mind as they're making these decisions. So moving on, if you feel like you've been traumatized in your birth, what can you do afterwards? I want to leave some of these things for Jessica to talk about afterwards. But I would say in the immediate days after birth, pay very special attention to your self-care. So that means resting. I mean, obviously after you give birth, you need to rest. But what I really mean is allowing yourself the space to rest. So not having a bunch of visitors, really resting in a comfortable space, like dark, quiet, clean sheets. Allow yourself the time to bathe and feel really comfortable. So how do you allow that? Well, you need to ask for help to keep the rest of your life running, I suppose. Whether you ask for that from a doula or from trusted family members, friends, whatever. But make sure that they're the type of people that will take care of these things so that you can really, really rest. You can also accept massages, herbal baths, and yeah, just make sure that everything else is taken care of so that you don't have this mental load. You can just release it all. You can take steps to regulate your anxiety first. So before even trying to process an experience, in order to be able to process it well, you need to lower your baseline anxiety. So, or else if your anxiety is already at a 6 and then trying to process that experience will put you back up to a 10 and then you're not getting anywhere. So try to bring your anxiety down to like a 2 or lower, even better, before you try to go into that. So whether that is meditation or prayer or medication, whichever of these will work for you. Managing the anxiety is the first course of action. Similarly, what helps to break down some of that adrenaline is oxytocin building activity. So I can't say the benefits of skin to skin contact enough. Skin to skin with your baby, what it looks like is the birth parent, or either parent actually, is topless and the baby is naked except for a diaper, basically. You can put this baby tummy to tummy or chest to chest on your chest. Pardon me, 1 second. I'm busy right now. You can't come in. Okay, go on. No, you cannot. Go. Thank you. Excuse me. That's my 9-year-old doing 9-year-old things. Skin to skin on your chest as you are just deeply relaxing while watching Netflix or whatever it is, you know, that you can do in a comfortable, supported position, maybe on your sofa. But yes, skin to skin is not like a, well, I'm just going to do tummy to tummy while we're changing the diaper for 5 minutes. I mean, like really, really relax both of you for a good 30 to 60 minutes. Let the baby sleep on your chest at least once a day. This will, like, it has a ton of benefits for the baby, and it actually has benefits for you. Building up your oxytocin will help to mitigate that anxiety. It will also boost your milk supply and help with your postpartum, the restitution of your uterus too. So, barring that, hugs, cuddles with your friends and family, your partner, those really sappy Hallmark movies or like The Notebook or something that will allow you to feel really happy, but also cry a little bit, like without it being an overwhelming, like, oh my God, my world is ending cry. Happy cries. Surround yourself with people who are good, active listeners. So people who listen to understand and validate what you're going through, as opposed to people who listen to try and fix it. Oh, well, have you tried yoga, or have you tried going for a walk? Or maybe you should just not think about it so much. Focus on the fact that you have a healthy baby. You know, things like that are not super helpful. So you want somebody who really knows how to actively listen. And maybe you don't necessarily have that person in your life right now. And if not, it's perfectly acceptable to go to a trained counselor. But yes, so barring that, if you're feeling a lot of anxiety, sometimes the anxiety and the flashbacks and all of these things get your nervous system really amped up. Repetitive tasks like knitting or kneading dough, if you like to make bread, doing a jigsaw puzzle, or puzzle games like Tetris on your phone, like, or those match 3 things, like that's just really repetitive over and over and over, can actually really help to settle your brain down a lot. So finding community. I loved what Rebecca said about the moms groups and group therapy. Group therapy was one of the most helpful things that I did for myself, because it was real-time validation of what I was going through. And I was also able to give that back to other people who were experiencing similar or different challenges. Being able to help somebody, especially when you're depressed, it really, I don't know what the exact neurochemicals are, but I guess it gives you like a dopamine boost and you feel good about yourself afterwards. And it's a wonderful thing to do. So, not putting yourself too far out there when you've just had a baby. Obviously, you can't be everything to everybody. But if you're in a group therapy situation, it's a give and take, right? And this is less intuitive, I think, but one of the most wonderful things for healing trauma for me has been mind and body exercises, things where your mind and body go together. So obviously the first one that a lot of people think of is yoga. But I would like to put up there martial arts and choir or singing or chanting, anything that uses your voice, because your voice helps to stimulate your vagus nerve, which is a nerve that goes from your brain down through your body into your gut. It is not it's a cranial nerve, so it goes directly from your brain into your body. It doesn't stem from the spinal cord. So how does this help? Like, this really just helps to mitigate some of these severe fight or flight feelings that you're having in your body. What was a real, like, not to exaggerate, lifesaver for me was learning to play capoeira. Now, capoeira is not something you do immediately postpartum because it's very physical, but it's intense physical activity married with mental activity. Like, you have to plan your moves like you're playing a game of chess. It's community. There's a very strong emphasis on community in it. And there's a lot of singing. So you use your voice a lot. And like a few sessions of capoeira, and I was feeling so much incredibly better. I don't suggest, again, intense physical activity in your immediate postpartum. But if you find yourself 4 or 6 months later still suffering, I would, at that point, suggest you try seeking something like that out, or another martial art, or anything that can combine movement and voice. So how do doulas help? Well, we're here to help remind you when you're in labor of your calming techniques and the rituals. So we familiarize ourselves with your personality, what you have found that works for you, whether you're using hypnobirthing or some other technique. And so when we see that your anxiety is rising when in labor, or something is happening that you're having trouble to integrate, we can remind you of the techniques and help you move through that. We can help co-regulate the emotional physical response. So that co-regulation of matching our breathing, matching our tone of voice, matching our posture and our relaxation. And of course, just being there so you know that you're not going through it alone. We're trained in active listening. Pretty much every doula training organization, like, listening and communication is sort of the cornerstone of what we do. Finally, in the postpartum area, we can take care of tasks that you can, like the laundry, the feeding of the older children, the little tidying up, so that you can really deeply focus on your healing. And we can help to connect you to resources in your community. So hope that was somewhat helpful. I'm always open to talk about my experience, or talk more deeply about any of these other things. If you want to come in contact with me, you can ask through the office at Helping Hands Doula, and I'll be happy to chat. Thanks.
Thank you so much, Christy. And now we're going to have Jessica, who's a postpartum doula on our team, talk a little bit more about the postpartum period. Jessica realized her strengths were apparent in serving others during her own postpartum period, so she became a doula. She loves a good coffee, especially if it's shared while catching up with friends. So take it away, Jessica.
Sorry, can you hear me now? I am sorry about that. Hi there, thank you for joining us tonight. So I'm going to be talking a little bit about how doulas can help out, particularly when it comes to postpartum mental health. So, generally after you come home with your baby, we expect that there's going to be a lot of changes all, physical, emotional, and mental all together. And this can present some challenges, but what doulas do is try to lay a foundation for a healthy and positive postpartum experience, which can vastly improve the overall outcomes of the parents involved and their mental health across the first year after birth. So first we'll talk about community. And, in this, we have local resources, which has been talked about already, but doulas come into play where, you're really focused on taking care of your newborn, and this is a lot of work in the first little while, and I think you can easily forget about that there's a whole world out there. And so we can help remind you that, we have a lot of community centers, early on centers, and parent groups, and we can connect you with those. Sometimes just meeting other individuals that are in similar life situations as yourself can reduce worry and increase feelings of well-being, just knowing that, there's people in your neighborhood that are going through a similar experience as you. And also prevent isolation, which is a huge contributor to feelings of anxiety and depression in the long run. Also, your long-term relationships. So doulas help support those. As a new parent, your personal needs change a lot in the beginning, and this can be challenging to accept for yourself and for the people around you. So doulas can help break the ice, discussing ways that family and friends can help out with you around the house with the baby. And it can also help increase your partner's confidence in helping to care for the baby as well. All of this is to say that lightening the load for the birth partner overall with helping with the baby will benefit their mental health in the long run. We also help the parents to normalize accepting help, which I think is a really big trap that people fall into, like, oh no, it's okay, I've got it. We all want to show our friends and families that we're an amazing parent and that we know what we're doing. But actually, we like to teach people that it's great to say yes to help, and that people really want to help you. Sometimes they don't know how to help, and so we can break the ice and start conversations on what it is, ways that the people around you can help you out, and to make you feel more comfortable with that. And next, we will talk about compassionate care, which is a huge cornerstone of what we do as doulas. Flexibility being one of the huge components. So we do our best to anticipate clients' needs. We try to read the room. We deal with a lot of different people with different personality types, and we are non-judgmental. So essentially, doulas walk into your home with flexibility and empathy, being a neutral ally, because we love our family and friends, but they cannot always be non-judgmental towards us. So that is what doulas do. We also offer empathy, which is a huge part of our care, which you think is obvious, but it's not always easy for people to be empathetic. So we encourage a lot of bonding with your baby. We see that, like, it's okay if you don't bond with the baby immediately. We know that that's pretty common, and we can help you create an environment where you can do that and increase your confidence as a parent. We also really encourage opportunities for sleep, nourishment, and time outdoors. These are things that every human being needs to thrive and we take for granted. But when a baby comes, they soak up a lot of that time. So as doulas, we're here to tap you on the shoulder and remind you that it's important to go take a nap. We can help prepare a snack for you, or encourage you to go for a walk. These are things that are so, so important for someone's overall mental health. And so the next slide, seeing the signs. As doulas, we offer reassurance because, as it was also discussed with Rebecca, a lot of the different feelings, thoughts and emotions that happen after having a baby are very common. It may not feel normal to you because this is new to you, you've never been here before, but we can help you understand that everything's going to be okay, and it's okay that you are feeling a lot of ups and downs right now. But we're also first responders at seeing, red flags. So talking about some of the signs of mood disorders associated with the postpartum period. We're not trained to diagnose any of those, but we're mostly trained to open lines of communication with your family, and guide you if you needed to seek any outside specialized care. But I think most importantly, just to close off that thought, is that your doula will help lessen shame and guilt around any of these mental health challenges or issues that you're experiencing. We are there to listen to you. We're there to just keep you company, and to be there for you during a very important time in your life. So that is all. I hope that it was helpful, and looking forward to meeting all of you.
Thank you so much, Jessica. So much great tips and tricks that everyone shared today. I'm going to invite anyone who has questions to contact us at the office, because I would love to jump into my favorite part of the meeting, which is the meeting of the team. So please don't be intimidated to go into the breakout rooms with us. Please stay. We would love to meet you and just chat with you a little bit more.